How is your motor system assessed in a neurological exam? Imagine trying to understand how well your brain and nerves are working by checking how your muscles move and respond. That's exactly what a neurological exam does when it comes to your motor system. It's a detailed process that helps doctors see if there's any problem with muscle strength, tone, coordination, or reflexes, which can be signs of issues like brain tumors or other brain health concerns. First, the doctor will look at your muscles. They'll check for size, shape, and any unusual signs like scars, swelling, or involuntary movements such as tremors or twitching. This visual inspection can reveal clues about nerve or muscle damage. Then, they might gently feel your muscles, a process called palpation, to see if they're tender or if there are any lumps or abnormal muscle bulk. Next, the doctor assesses muscle tone, which is the tension in your muscles when they are relaxed. They'll move your limbs passively, meaning they'll move your arms or legs without you doing anything, to see how much resistance there is. If your muscles feel floppy or loose, it might suggest nerve damage. If they feel stiff or resistant, it could point to conditions like spasticity or rigidity, which are often linked to brain or spinal cord issues. Muscle strength is then tested by asking you to actively move your limbs against gravity and resistance. The doctor will push against your movements to see how much force you can generate. They score your strength from 0, meaning no muscle contraction, up to 5, which is full strength against resistance. Comparing both sides and different muscle groups helps pinpoint where the problem might be, whether it's in the brain, spinal cord, nerves, or muscles themselves. Reflexes are also a key part of the exam. Using a small hammer, the doctor taps specific tendons like the biceps, triceps, knees, and ankles. These reflexes help determine if the nerve pathways are intact and whether the problem is in the upper motor neurons, which originate in the brain and spinal cord, or in the lower motor neurons, which connect to muscles directly. The doctor will observe for any involuntary movements like tremors or tics. They'll also perform coordination tests, such as touching your finger to their finger or your nose, and heel to shin movements. These tests check how well your cerebellum, the part of your brain that controls coordination, is functioning. Abnormalities here can be signs of brain tumors or neurological diseases. Finally, they'll watch how you walk and perform simple tasks. Gait and balance are important clues. If you stumble or have difficulty walking smoothly, it might indicate weakness or coordination issues caused by brain or nerve problems. All these steps together give a comprehensive picture of your motor system health. When it comes to brain tumors, this assessment helps doctors see if the tumor is affecting motor pathways in the brain or spinal cord. It guides further testing, like imaging scans, and helps plan the best treatment approach. Remember, every person is different, and a thorough neurological exam is essential for accurate diagnosis. Always consult healthcare professionals for personalized advice and care.